look at fat-soluble vitamins. Vitamins, like I said, can be classified either fat-soluble or water-soluble. So let's take a few minutes and look at some of the characteristics. When we take in vitamins that are fat-soluble, those fat-soluble vitamins are going to be stored within the liver and within the adipose tissue. The fat-soluble vitamins are vitamins A, D, E, and K. And they are not readily excreted. So once we eat them, we store them. Excess consumption over time could then lead to toxic levels. So that's something to keep in mind, and it's a difference between the fat-soluble and the water-soluble. If somebody is talking to you, maybe you have a patient who's talking to you about vitamin supplements, and they're specifically focused on one of the fat-soluble, you might want to let them know that as long as they're eating healthy, they don't need to supplement, especially the fat-soluble vitamins, because we do store them in the body. And if they take in a supplement on top of that, that could be in excess, and that could lead to toxic problems down the road. We know they're not easily excreted, and like I said, they can become toxic if consumed in excess. So what I want to do is go through each of the fat-soluble vitamins and have little tables to give you the basic characteristics of each of those vitamins. Let's look at vitamin A first. Vitamin A can be found in two different forms. We have the preformed vitamin A and we have the provitamin A. And there's a difference between those. The preformed vitamin A is the retinol and the retinal. The provitamin A are the carotenoids. The difference being the preformed are found in your animal products, and the provitamin A, or the carotenoids, are found in your plant products. And the carotenoids include, probably the best known is beta-carotene, which we find in a lot of our red, orange, yellow, and green vegetables. So what do they do? When we look at the preformed vitamin A, you can see that the different functions are listed here on this screen. Most widely recognized function is for vision. Retinol is a form of vitamin A that helps the eye to adjust. So it helps you to adjust from bright light to dim light. And without adequate intake, your eye isn't able to make that adjustment. And that leads to something called night blindness. So if you're talking to an elderly patient who might be saying, I don't drive anymore at night, they are probably having some eye issues related to the inadequate intake over time of that preformed vitamin A. Also part of it's the natural aging process. But think about how important it is for your light to be able to adjust from dark to light. If you're in a movie theater and you go from a very dark area to a light area, you want to be able to make that adjustment quickly so that you're able to see. And sometimes that doesn't happen whenever you're taking in inadequate amounts of vitamin A. The other issue that can occur if you don't take in adequate amounts of vitamin A occurs over a period of time, and it's called xerophthalmia. And this is a condition where the eye itself starts to dry out. You're not making the mucus that keeps your eye moist, and over a period of time it results in blindness. That doesn't happen a lot, especially in this country you're not going to see it, or in developed countries, but in third world countries you may see xerophthalmia develop because of the lack of vitamin A. In addition to vision, vitamin A is also important for immunity. It's important for external skin health, so that the epithelial cells in the GI tract and the cells on the skin act as barriers to prevent bacteria from causing infections. So we have vitamin A for immune health. It's also needed for growth and for development and for disease prevention. And the provitamin A, the carotenoids, which are the precursors to the preformed vitamin A, are important as antioxidants. Couple things to keep in mind. It's important to know that with the preformed vitamin A, if you take in too much, it can lead to toxic levels. But the provitamin A, because it is a plant form, will not become toxic. So you can eat large amounts of carotenoids. You're not going to have any issues with toxic levels. Now, you might find that your skin starts to turn a little different color. You might notice that you're becoming a little orange or yellow if you're taking in excess amounts, but that's not toxic and it will go away. That gives you a pretty good summary of vitamin A, and you can look over the chart as well as your notes to get additional information on that. Looking at vitamin D is unique because it's a vitamin and a hormone. And vitamin D occurs in two forms. You see ergocalciferol and cholecalciferol. Ergo, which is vitamin 2, is the synthetic form, and cholecalciferol is made by the human body. Actually, we make most of our vitamin D. We actually do not need to consume it. 10 minutes of sunshine 2 to 3 times per week provides 80 to 100% of our vitamin D needs. However, in some cases, if you live in a climate that you don't get a lot of sunshine, if you wear a lot of heavy clothing, if you can't be outside, you're not going to make adequate amounts of vitamin D. So we do need to make sure that dietary intake is important. Primary function of vitamin D is calcium regulation. And of course, calcium is important for bones. So if you're not taking in adequate amounts of calcium, we're going to start to see deficiency symptoms. And those deficiency symptoms in children show up as rickets. Their bones are soft, they're not getting enough calcium to harden the bones, and they end up with the bowed legs. That's one of the hallmarks of the signs of ricket. In adults, we start to see osteomalacia. Osteomalacia means soft bones. And of course, we hear about osteoporosis as well. As we age without that vitamin D intake, we start to lose calcium from our bones. You start to get little holes in it, and bone mass decreases, the bones thin, and become very porous over a period of time. As you can see, the different sources are listed in terms of we can make it. You can also get it in fatty fish, eggs, yogurt, and dairy products. Vitamin E, this is the third fat-soluble vitamin. Vitamin E, the chemical name tocopherol, and there are different forms, alpha tocopherol and gamma tocopherol. One of the major functions of vitamin E is that it's an antioxidant. So it protects cells from free radicals. Free radicals can alter a cell's DNA, it can cause damage to the cell membranes, and can increase the risk for cancer. Vitamin E has been widely touted for a number of different reasons. At one point it was known as a love potion, an anti-aging potion. It has been marketed for heart health throughout the years. Deficiency rarely occurs. We get vitamin E in a lot of different foods. As you can see, sources include major form in plants. So it's not difficult to get vitamin E in our diet. We also find it in whole grains. But we can be concerned if somebody does have a vitamin E deficiency because of hemolysis. And hemolysis is a breakdown of the red blood cells. Fairly rare, but something to keep in mind when working with patients. And then the final fat-soluble vitamin is vitamin K. And unlike the other three, vitamin K actually disappears from the body within 24 hours. I think most of us are aware that vitamin K is primarily involved in the process of coagulation or blood clotting. We can get vitamin K in our diet. You see the different sources that are listed there. And we also synthesize vitamin K in our intestinal tract or our gut. Deficiencies, again, pretty rare. You might see a deficiency in infants, and actually when infants are born, they don't make adequate amounts of vitamin K, and so all infants are given a vitamin K shot in the nursery in order to make sure they have adequate amounts before they're sent home. An older adult may have some issues with a deficiency, and somebody who has been on antibiotics for a period of time may also have issues with a deficiency. In addition to the blood clotting, it's also important for bone formation, to bind calcium to the muscles and to the kidneys. So that gives us a general overview of the fat-soluble vitamins.